can we talk a little bit about women who have developed painful intercourse, that sex becomes very uncomfortable, and then they've kind of got into a bit of a fear cycle of having sex because really that just in their brain it is now that this is a very uncomfortable experience. So obviously we're going to go and try and give them some vaginal hormones, but what other techniques do you bring into play to try and get that woman to feel comfortable again with having penetrative sex?
That's a great question. So there's a couple of things that I recommend, actually 3, of which one can sort of be clumped into one. So I really, really value the role of a pelvic floor physiotherapist, which now is becoming a lot more recognized in terms of their role in supporting patients. Sometimes they also talk about the use of dilators as well. And so I encourage patients to talk with their pelvic floor physiotherapist about the use of vaginal dilators and maybe show them how to use it. And, if it takes 5 years for you to start having symptoms, it sometimes may take a while for those symptoms to, be reversed. So this is a progress. It's not about getting to the end right away. I know some patients have a lot of embarrassment and shame and guilt around not being able to be intimate with their partners. And it's sort of this feeling of weakness. There's a fear around the word aging, and it's really hard for them from a psychological standpoint to come to terms with it. So working with a pelvic floor physiotherapist and giving them that confidence again with their ability to potentially have penetrative intercourse at some point is very valuable. The other thing I also talk to patients about is getting a sexual counselor or a psychologist who specializes in sexual health, because there can be maybe some history with a previous partner. There could be previous sexual abuse that we're not aware of. And so by addressing some of these concerns with a therapist and understanding the differences in desire, in terms of responsive desire, can also help a woman to feel more comfortable in the bedroom with her husband. The last thing is there is a book in Canada that we have, which is written by a psychologist who does a lot of research in sexual health. Her name is Dr. Lori Brotto, and she wrote a book called Better Sex Through Mindfulness. So I also encourage patients to read that book, because a lot of comfort in having intercourse does have to do with being present and being mindful, and sometimes that gets lost. And so I also recommend that book to them as well.